Tension headache, the vice feeling. This is the expression of tension headaches. When you talk about headaches, you usually talk about tension headaches, because they are the most common form of complaint. Women have tension headaches slightly more often than men. The exact cause of the tension headache has not yet been clarified. The symptoms. Tension headaches are noticeable as dull, pressing to pulling pain. It often starts in the neck and slowly spreads over the entire head. Tension headache sufferers then feel as though they are wearing a hat that is too tight or wedged in a vise. The pressure is often greatest on the forehead and neck. Occasionally the pain extends to the eyes or cannot be clearly localized at all. There is seldom a slight sensitivity to light or noise. If left untreated, tension headaches last from half an hour to a week. Physical activity does not make the tension headache worse. On the contrary, walks often alleviate the discomfort. The intensity of tension headaches is usually mild to moderate. This does not prevent the normal daily routine, but in many cases it disrupts it considerably. The pain can be felt in the background and is perceived as a constant unpleasant companion. If symptoms feel more pulsating, it is most likely a different type of headache. Tension headache can be chronic or episodic. In order to treat those affected properly, experts first divide them into two groups. There are two types of progression. 1. Chronic tension headaches and 2. Episodic tension headaches. Chronic tension headaches are when the symptoms occur for at least 15 days a month for more than 3 months. Meanwhile, those affected suffer from tension headaches on average every other day. The chronic course is less common, it affects about 13% of patients. The rest are affected by the so-called episodic form. The tension headaches only occur occasionally. Tension headache, what will help? Chronic tension headaches should only be treated by an experienced doctor. Acute pain relievers are not suitable for long-term therapy. Instead, treating tension headaches is about identifying triggering factors and alleviating them. Typical are psychosocial stress, work, family, everyday life. Working in the wrong posture. Working in poor light. Too less sleep. Nicotine use. Grinding of teeth, general disorders of the chewing apparatus. In the episodic form of tension headache, however, patients can usually treat their symptoms themselves. Suitable for this are, for example, painkillers. At the same time, heat and cold applications as well as relaxation methods can effectively alleviate the tension headache. Why continuous ciders get frequent tension headaches? Attention couch potatoes. Those who sit constantly can get chronic tension headaches. Because the one-sided posture easily causes tension in the neck area. If nerve tracts running towards the head are pinched as a result, it has already happened. Tension headaches will set in. The longer such complaints last, the more likely it is that a so-called pain memory will develop. This means that the nerve tracts still send signals to the brain even after the actual cause, for example the tension, has long been resolved. The tension headaches have then become chronic. To prevent this, experts recommend exercising regularly. Do light endurance exercise for 45 minutes at least twice a week. Once the tension headache has arrived, it is important to remove it as quickly as possible, for example with the help of heating or cooling applications. This succeeds for example by warming the neck with a hairdryer at a comfortable temperature for 15 minutes. This loosens the muscles and relieves tension headaches. Pain tablets also help the muscles to relax. Applied early, they can prevent a chronic course.